Hi, Meg.
Jee's here. So how's your week been?
It's been good. It's been really good, actually. It just goes so quickly, I think.
I know, isn't it weird how, you think all this time on your hands, but really
No, it goes
they're
really quick.
flying, it's going quicker than when you're like working like 9 to 5 for some reason.
I know. I did go into clinic this week. I saw a couple of patients in clinic on Monday, so I'm easing myself back into that, and that was nice to go back there.
Yeah. Are you
And
doing bloods yet?
yeah, yeah.
Yeah, you are. Okay,
Yeah,
great. That's
I'm
good to
taking them
know.
myself. I'm taking them myself, so that way it keeps everybody safe. We've both got
Yeah,
masks on and gloves on, and then I take the blood myself.
perfect.
Yeah.
Because that's what someone was asking me. They just said they wanted to get their bloods done. Were you doing blood? So yeah, if you're listening out there, we are.
Yeah.
Okay, so this week we're doing everything that's not hormonal.
Yeah.
Not HRT, not body identicals. If you can't for medical reasons or you just don't want to, you're going to give us the whole spiel and talk on what we can do naturally.
Yeah, I mean, there's so much out there, and one of the things is that just to put into perspective is there aren't that many like clinical trials or strong, robust evidence for using this supplement or that supplement. But what I've taken from all of that is there are lots of positive stories from women who do use them. And there's something called the placebo effect. The placebo effect is when somebody takes a medication, even though it might be a smartie, but because they believe that it works really well,
Yeah.
that they actually feel better. And what we found with a lot of these alternative therapies or supplements, that women do actually benefit from them because there's a strong placebo effect, up to 60%. So even I was surprised because I thought it was more like 30 to 40%, but it can be up to
Wow.
60%. So I've done a lot of research for you all, along with.
Brilliant. Well, I'm just going to let you fire away here then.
Okay, so I mean, one of the symptoms that I suppose everybody talks about is hot flushes.
Yeah, I'm feeling it now.
Are you feeling it now? So what can we do for it? And why? First of all, why do they happen? It's because of the drop in estrogen levels. Estrogen helps to regulate our body temperature. So when we don't have that estrogen, we get this whoosh of hot flush and sweat that night and broken sleep. So what are the natural things that you can take? I've looked into it for you, and one of the things is sage. And I've mentioned it before, you can get sage capsules. Also vitamin E supplements actually help very much so with them, but you have to take them at a strength of 400 micrograms daily. So vitamin E supplements can be very useful to manage that.
Can I just ask, is there something about if you take too much vitamin E though, something can happen?
Yes. So you have to take it in at that dose because it can then have a negative effect, and it's just slipped my mind what that is right now. But
Yeah, sorry.
I'll find it and I'll write it down for you. But
I just remember reading something.
Okay, and so you can also get natural phytoestrogens and isoflavones. So for hot flushes, because of the dip in estrogen, there are natural, people might have heard of phytoestrogens or isoflavones. And, those are words you hear a lot when it comes to menopause and treatment for menopause, but people might not really know what they mean. And what they are plant-based, and they mimic estrogen. They're not actually estrogen, and they mimic estrogen and act on the estrogen receptors. So they can dampen some of the symptoms that women get due to the depletion of estrogen. For example, the hot flushes, night sweats, insomnia. And I've made, and there are foods that you can get them from, like soy, beans, like chickpeas. Let me just have a quick look at my list here. Flax seeds are really good. Linseed, pumpkin seeds, and also black cohosh and red clover. So,
okay, now with black cohosh, because I've never taken it, but there is a thing, isn't it? They get very medically. It can, it has this sort of frightening thing to me that goes with it. Because whenever I've sort of said the word, people go, "Ooh,
black cohosh."
Yeah. What? Why? Do we know why do they do that? What?
Because so if you take too much black cohosh, it can interfere with other medications that you might be taking.
Right. Okay.
So you have to take it cautiously. Also, you know, if you are somebody with breast cancer, black cohosh and red clover, although they are natural sources, you know, from plants and things, they're still not recommended for women with breast cancer. So, you know, just because people think they are plant-based doesn't mean to say that they are safe in all circumstances. And that's just something to bear in mind. And you can get supplements that contain black cohosh, contain red clover, and they can help. I would say they tend to help more on the side of less severe symptoms. But, you know, they may be enough at the beginning of your perimenopause when you're feeling maybe fatigued, when you've got mild symptoms, or maybe, you know, later on down the line, or obviously if you can't take or don't want to take HRT. So those are things that can help sort of naturally boost your, or mimic the estrogen within your body. And you know, black cohosh, that it's even reported that it can help with vaginal dryness to a certain degree. I mean, so I mean, none of these things do the same as HRT do, or
of course.
But they can help to alleviate some symptoms. So
if you're, like you're saying, you can't take HRT or you can't take body identicals, so you could you take sage, red clover and black cohosh? You could take all of these, and vitamin E?
And
all of them,
flax seeds in your diet, you know, you can take your smoothies, linseeds, you know, all of those kind of things can be very helpful. And if people, you know, things like soybeans, edamame, tempeh.
Love edamame,
and tofu. And I bet you're going to now ask me, is soy safe? Are you going to ask me that, Meg?
Well, I'm not, but you should explain to everybody, because I eat a lot of soy, but I eat very healthy. I eat a lot of soy. I don't drink pints of soya milk, but I eat a lot of soy in my diet because I'm vegan. So I have a lot. But it's healthy, it's not GMO, it's, you know, it's organic. So explain away, because, you know, everyone goes,
Everybody does, because they think, oh, breast cancer. And I don't know where this myth has come. So I did actually quite a bit of research in the last week to think, well, is soy safe or is it not safe? Because, you know, there are people out there saying we shouldn't be taking soy because, you know, it does the same, it feeds the estrogen-rich breast cancers and things. Actually, it doesn't. You know, I think there is no hard, fast clinical evidence that soy is bad for you at all. And, you know, if you think about countries like Japan, where they have a lot of soy in their diet, you know, people do benefit from it. And there are studies to show that people benefit from soy if you start it at an early age. So you're starting it in, you know, in your teenage years or even
but really early, and they come out. And also we know that back, like in Japan and that, they do not get the symptoms like Western women get. They do not really get this. So it must be generations after generations of eating soy from a very early age. And of course it's healthy soy. I mean, you know, I want to just say, you know, like if you go and you just don't buy it from the US or anything like that, just make sure you have really good product. That's all you've got to do, and make sure that it is.
So and alongside that, because one of the reasons that the Japanese women also don't suffer so much with the hot sweats and hot flushes is because they have a lower caffeine and a lower alcohol diet. And we know things like alcohol and caffeine trigger off hot flushes. So some of it is our Western lifestyle, or our not so good Western lifestyle.
Black cohosh did nothing for me, so I was going until I got body identicals. Well, we're trying to say, that we, you know, if you have the choice, of course, go to body identicals. But I know a lot of my girlfriends, well, not a lot of them, because they're all going this way now. But you know, they all start off, probably 1 out of every 3 is, I'm going to do it the natural way, Meg. I'm going to do it the natural way. I give them probably 8 months or maybe a year, and then they're back. And then they're just like, help me, you know. But I completely have, you know, I know if you can't, if you've like, you know, if you're, you know, if you've had cancer, or, you know, you just can't, then, you know, I'm not trying to, you know, be awful to you lot out there. But, you know, these things, like you say, because I've got a girlfriend of mine who swears by sage tablets. She had a really early menopause. She was 36 after she'd given birth to her 2 sons. She just went straight into the menopause. So she did sage tablets. She made me laugh because she said every time she burped, she felt like she had a chicken dinner. But, and that was the one side effect that it had on her. But that red clover, sage, and it helped her get through. And now she's the same age as me. And she is going to be calling you very soon in the next few days. And she's going to go on, she wants to go on Body Identicals. Yeah.
Fabulous. I mean, it slightly reminds me of, you know, people saying they want to have a natural childbirth. You know, I was very much, I want to have a natural childbirth, natural child. When the pain kicked in, I was like, give me the painkillers. Give it to me.
Yeah. Me, so exactly the same.
Yeah,
I was the same as well. I'm not going to have an epidural. I'm not going to have an epidural. And then I kept thinking, everyone says, don't leave it too late because then they just go, sorry, you're way past it. And then I was just like, quick, give it to me now. I said, I'm not past it yet. You know, because I was just like thinking, that's all I kept fearing was when they turn around and go, I'm really sorry, you know, you're past it, you can't have it now. So I remember I was doing the same. Exactly.
I mean, somebody just said an interesting point there that I kind of want to touch upon is acupuncture. They said acupuncture, they had 2 sessions and they felt fabulous afterwards. And the truth is, a lot of women do benefit from acupuncture. But when they've done the trials to
can you hear that?
Awful. I know. What are you having done?
It's the gardener. Sorry.
Okay. No.
It's so past now.
So now I was saying when they've looked into the evidence behind acupuncture, so they've done trials to look at acupuncture versus what they call sham acupuncture to see, you know, is acupuncture genuinely, you know, a treatment? There was actually no difference. But women who do get have acupuncture benefit a lot. I think it's sometimes the time that's spent, it's the relaxation that they get. It's also a strong placebo effect. But, you know, scientifically, if we're just looking at the scientific papers, there's no actual difference. But I'm not saying don't go. It's a bit like when you go for a massage, you feel much better.
Of course.
You feel more relaxed. All of those aspects. So acupuncture, I know, does work for a lot of people. But, you know, but the actual science behind it is not so robust and strong.
I mean, I did acupuncture, I did tapping, I mean, the list that I did was, I did kinesiology, I think it is. I did, there's another one of these mad things. I did Chinese herbs. I mean, you know, my journey before I knew what was really going on or where I could get this from. I mean, for about a year, I even had a healer from Hawaii to send me vibes to do this. And me and my girlfriend Janice, she's like a hippie, we did this journey together. I was going, well, what have you tried? What have you did? I mean, we did the most weird stuff to just try and, but also weird. Cost bloody thousands of pounds. We all added it up. And so don't go out there and please try all these things. I mean, for me, I was in a position that I could do it, but it you know, it still annoys me to this day that I just didn't go and get my body identical.
But at least you can bring that information now and share it.
Yeah, I mean, I've done everything.
So they don't have to go around in circles like that.
I've done it all. Yeah, you name it, craniology, you name it. I've done it. I've tried it all. There's nothing I didn't do. Right. So also, I've got a question here. Right. So, Dr. I've got quite a few, but quite a few of them were talking about HRT still. So. Right, so it says I'm 52.
But they can watch our talk from last week, can't they, on HRT? I thought that was
absolutely. We've said this, and they can watch that. And it's not really. They just said, I'm 52 this year. I had a full hysterectomy at 50. I had a blood condition called Lithin V, protein C, Leiten. V.
Okay.
Protein C deficiency, which means my blood clots really well. I am on no medication for this, but if I had surgery, I have blood thinning injections post-surgery for a couple of weeks. However, this means I can't have HRT. I spoke to my doctor about Body Identical's HRT, and she advised anything that mimics estrogen could be a risk for me. I'm trying to muddle through this fog using Menopause. In January, she she prescribed me fluoxetine, which I'm still taking. They just make me not feel anything. Fluoxetine, is that an antidepressant?
It's an antidepressant. That is one of the problems with antidepressants, is that they're kind of numb and flat. You know, they don't make you feel low, but they don't, they sort of flatten your excitement, I suppose, and
Right.
also impair your ability to orgasm. And
this is what she says: I have no libido, I don't sleep very well, I have terrible hip pain constantly. How can I get help?
Okay, well, that's a really good one for us, isn't it? Because she's got this blood clotting disorder, which really makes it, you know, very risky for her to go on to hormones. So when it comes to, you know, sort of boosting your sex life, boosting your libido from a natural point of view, there are things like ginkgo. Ginkgo has shown that, you know, there's some small evidence for ginkgo. Ashwatthanga, which is another herb.
Yeah, I take that.
Okay.
Yeah.
Sea buckthorn.
Yeah.
And there's something called horny goat's weed. But, you know, I mean, horny goat's weed. But, and all of those things can help sort of to
lift the libido.
Yeah, they can help. Also, there are things like maca or matcha. You know, you can have
matcha
teas.
So I have maca in my you know, the Meno blend. I've got maca in there.
Okay.
Because it's one of the superfoods that's in there, which is really good. Right.
And also they help to boost your natural sort of testosterone as well. So exercise, you know, exercise will help to naturally boost your testosterone and naturally boost your endorphins.
Sorry, everyone, I just kicked you all over.
So you know, don't forget on exercise. And from a more, I suppose, natural point of view, from a mood boosting, St. John's wort can sometimes help, but you have to be careful depending on what.
That's another one, yeah.
But that has shown some scientific and clinical evidence.
Yeah.
Yeah. Again, hot flushes and mood, so yes.
Okay, well, I hope you don't mind. I was wondering. That's the weight loss one. Okay. Can I ask a question? I just want to answer this. Are cold sweats related to the menopause? The reason I'm asking, I've just recently been in hospital because I've broken my ankle. Ever since this happened, cold sweats have been really bad. Chilly from the inside out, but sweating really badly.
No, I mean, I think they sound more like, I mean, those are the kind of sweats most people get if they've got an infection or some chills.
Yeah, that's what I was thinking. So maybe if you've just broken your ankle, maybe you should go back and have a check. Because I was going to say, when you get that, that's an unwell feeling, isn't it?
Yeah.
That chilly, like you sometimes have a temperature, but you feel chilly and you're a bit like, ooh.
Yeah, let's rule out coronavirus before anything else.
Yes, absolutely. Okay,
so, and for the joints, she mentioned her joints as well. And her bones. You know, always really think, let's go back to basics. Calcium and vitamin D for your bones, you know, for your bone strength, you know, for when you can't take, you know, sort of other kinds of hormones. Other things like cod liver oil, oily fish, sardines, mackerel, salmon. Those can all be very, very helpful. And an omega supplement, omega-3. And turmeric. Omega and turmeric are natural anti-inflammatories. So taking, you know, whether turmeric you might have in a tea, omega you might get from your fish and your, you know, I always think it's nicer to get these kinds of
I'm 100% with you there, guys. I mean, if you can get things through your food, don't just think that a supplement is better than food, because it never is. If you can get, like Dr. Harper says, get it through the food, it's more than likely than you just popping a tablet in. It gets absorbed so much better if you, and it's just so much better for you. I mean, because I remember at one stage, I would just pop. I mean, I had a clear out this lockdown, and I threw away, well, I didn't throw them away. I gave them away to most of my friends, but I had about 200 different tablets because, of course, I do the Meno blend every day. So I just was like, you know, from my years, I was just like that, because I would be like, you know, just taking all sorts of supplements. And, you know, you're just chucking all these supplements in and they just sort of rattle around with you. But, you know, like vitamin D, I would 100%, you know, all these and a few of them, but don't try and get it in your food. Like, you know, loads of green veg every day. I can't tell you enough times, you know, really lots of broccoli, kale, you know, all those greens are really good. And if you can do oily fish, definitely would have oily fish. I don't do oily fish, of course, but, you know, get it in there. Just, but really, I probably say that probably 80% of my diet is probably loads of greens. I mean, I even have a vegetable bowl when I'm intermittent fasting at the moment. So I'm, but like really late until like, I'm not eating until 4.
Oh,
but, you know, but I will break that with this huge bowl of greens with some avocado, really good olive oil, black pepper. It's amazing, and it's so delicious.
They're going to keep you full. Those are good fats. They're going to keep you full. They're good for your skin, you know, for all of those elements.
Yeah, and loads of avocados and a really good, I mean, I really have a really good olive oil, like not one, you know, get a more expensive one. And I just have like a big teaspoon, and your oils and fats are the things that keep you from being hungry, as we know.
And simple things like, you know, even I'm a little bit late to seeds, like flax seeds, pumpkin seeds.
Yeah.
Just
shake them on.
Those are easy things just to sort of just have to hand and snack on if you need to. And flax seeds, like we put them into our yogurts and, you know, make a lot of things out of it. So those are all good things.
Yeah. Well, you never know. We might keep it going on. I had to go to private clinic to get my body identicals, and it's the best thing I've ever done. Well, I'm telling you it is. So everybody just, you know, Dr. Harper is here, the Harper Clinic on Harley Street. You can call, you can, you know, you can do it. But, you know, if you have been on lockdown, saving a little bit of money, because I know I haven't been out for dinner, I haven't bought clothes, and I know that I'm really quite excited. And now I'm just like, you know, less is more. I really feel like my whole way of life is going to change. You know, I think I will swap getting in a taxi and Uber to walking somewhere. I will just make sure I have an hour before. I mean, I'm going to really change my life in all ways. I'm not going to go back to the same mad dashing around. I'm going to keep to Zoom calls than that. But if I would have saved up, I would 100% advise to go and get the Androfem from Dr. Harper, to go and get the Estrogel, the Body Identicals. Do it. It will change your life. And I can't, in every way, don't live your life half-heartedly, or even half, like in aches and pains and foggy brain, because that's what I was. Now I am, you know, living the best of my life. So, you know, and that is because I have a clean diet, I have Body Identicals, and I exercise.
You do have to make the lifestyle changes as well. You know, it's not just medication. There is, you know, like you said, diet, exercise is really important from all of those aspects as well. So where you can, you know, I mean, I know everybody can't do everything, or, you know, budgets may not allow it, but where you can make those changes, do. You know, we can still do exercise, you know, simple ones. No one has to go and join an expensive gym.
No.
So and the other thing I would say is, because somebody did contact me yesterday to say they wanted testosterone, and I just need to say that as a doctor, I can't prescribe without seeing you or doing a consultation, because these medications can't just be bought; they have to be prescribed. So, you know, I'm sorry if you know, I can't just sell them to you.
No, of course you can't. I mean, it's like people always ask me, you know, they say, where can I buy Estrogel? I'm like, well, you can't, you know, and if you were able to buy it, I would be telling you where to buy it. But, you know, it's always good to go and look what's going on in your body anyway, especially at this age, because lots of things change. Your cholesterol can change. Your thyroid. I think it's good to keep an eye on all your body anyway, because, you know, these things, as we know, are not readily available on the NHS. And when they are, like we were saying, they just basically go to an average. So if you're hovering here, you will be much more precise and say, actually, Meg, your cholesterol is, you know, when they just go to me, cholesterol's fine, you know, you'll probably say, actually, you know, you should. Yeah. So, you know, so if you can, I would advise it. And have you read any more questions coming up?
Yeah, well, someone made a comment, like somebody said, does losing weight help? And yes, it does. So if you lose weight, it helps to improve your symptoms of hot flushes and general well-being. So, but one of the things we know is it can be difficult to lose weight, and sleep can be a big issue. And I wanted to say last week at the end of our session, the doorbell
Yeah.
rang. That was my CBD. And I wanted to say a shout out to your CBD because one, I particularly enjoyed the gummies, maybe a bit too much.
No, I know when you asked me, how many can I take a day? But I was just saying they're more fun. You know what? You won't OD on them. It's just that, you know, it's quite expensive, but they are delicious and they're sugar-free, aren't they? And you can't believe they're CBD. And they're vegan. And I'm the only one who does the vegan sugar-free in the UK because everyone else uses gelatine. It took us ages to actually bind them together because gelatine is so easy. It just binds them. It took us about 6 months to
and
actually...
CBD oil is really great from a calming sleep. And there are studies now out there from a perimenopause point of view that it does very much help with that perimenopausal anxiety and sleeplessness. And I have suggested to a number of my patients who can't take HRT, who've had breast cancer, but sleep is an issue, anxiety is an issue.
Yeah.
So CBD oil is something that I think, you know, very much.
Yeah, and it's, you know, and it's moving forward. I mean, they're even in the Independent 2 days ago. They're now looking at CBD and COVID already. They're starting to do trials. I mean, so we do know that, you know, CBD. Don't just think of hash. CBD is in an amazing. We take the whole plant and we cold press the whole of the cannabis plant, and then we take the resin out. And it's, I mean, it's amazing. I mean, you know, psoriasis.
You use it just underneath your tongue, don't you? The oil you just
you put it under, so then it goes, if you hold it under your tongue, it goes quicker into the bloodstream. I never understood that. Maybe you can explain that to me.
Because underneath your tongue, you have a lot of blood vessels. So it just absorbed directly into your bloodstream. Whereas if you were to eat, like the gummies, it goes into the stomach, and the stomach has to break it down before it goes into the bloodstream. So that's why anything under the tongue actually works much faster because it goes straight into your blood supply rather than being broken down by the stomach. So that's
perfect. Right, have you can read? Is there any more questions coming up there? Can you see?
It measures how you get just cannabis or hemp, Meg.
Cannabis or hemp? Cannabis. Hemp is just another. It hasn't got any. Hemp is just like a sack or a material. So do not buy hemp oil, whatever you do, please. I mean, I'm not going to say by, you know, by mine, but of course I am going to say by mine. But what I'm saying is I can guarantee. The thing is with CBD, there are so many companies out there and you can't always guarantee what's in them, you know, but you definitely know all mine is certificated, whatever, and it is, you know, what you're buying is what you're getting, what it says on the bottle.
I mean, one of the things to look out for, people, is when you are going for a supplement, is see if you can find that it has a THR label, which is traditional herbal remedies label, and then that means that it is, I suppose, it has gone through some regulation.
Yeah, absolutely,
which is a really good thing.
So the other thing here, someone just said to me, let's talk on this one because I've had this a couple of times. Is the Dutchie test any good?
I don't do it. I think it's really expensive and I think it's unnecessary. It just breaks, you know, you get lots of different parameters, which really, it just looks good because there's so many different things. But we don't need to know all of those things. You know, one of the things I keep coming back to is whilst I do blood tests, and, you know, so the Dutch test is from functional medicine. I do functional medicine. I've done the certificate in functional medicine. But, you know, it's not just about the numbers. It's about you and how you're feeling, your symptoms, and combining them. And I think you can do that without having to go through that expensive route.
And also, once you've got the Dutch test, what are you supposed to do with it? Do you just bring it to you? I mean, that's why I'm thinking, why would you spend that money, do the test? You sit at home with it. You can't really go to a doctor and say, here's this. You can sit at home and know what's happening to you, but you can't then move forward with it. So you might as well just save that money for the Dutch test and go and have your bloods done with a menopause doctor, shouldn't you?
Yeah, and I'm just going to say, Gabriella, whilst, you know, I love everything you do, but actually I disagree with you that America is ahead of the UK when it comes to menopause.
I agree with you. They are not ahead at all.
So that is something that we're going to have to agree to differ on. And so,
I'm with you on this one.
That out there. Because, you know, I take part in the International Menopause Symposium where we have everybody from all around the world come and present. And America is much more restricted than a lot of the of the rest of the world.
Yeah, absolutely. And that is why I have so many American women when I go to LA and stuff. I mean, you know, they're begging me for estradiol. I mean, they go to their doctors and they really, they haven't even got into the body identicals. They're just all about bioidenticals. So people cannot afford them. The average person can't afford them. And they're not being told that there is another, you know,
Exactly.
alternative at all. Yeah. Yeah. I'm agreeing with you there. Okay.
Okay. I just wanted to say there are some teas and drinks that people can get, you know, sort of green tea.
Oh my God. Good. No, America is shocking with menopause. Go on there.
Yeah. Thank you. Thank you, Perry Power. Yeah, I was just thinking green tea is quite good from a weight and a metabolic point of view because it helps with metabolic rate, but without giving you the palpitations that caffeine does.
Yeah.
So that's a simple one I just wanted to share.
Matcha's good. Matcha.
Yeah. And
matcha tea.
Yeah.
There's a good one by Honor, which if you go on, you see I take those tablets when I train. They help, and they do a coffee with all sorts of things that are like added to it, like different mushroom stuff, and they do a great matcha tea, which gives you lots of energy, but without the jitters, because I can't really do too much caffeine.
Yeah, that's it. So neither can I. So you don't get the jitters. And from the another point of view, from the sleep is, you know, there's a supplement which works quite well. Lumity is quite a nice supplement because it's evening one. It does help you to sleep. You know, help you to sleep a little bit better. So that's quite a nice supplement to take on overall well-being. They have a morning and a night one. And I just wanted to touch on CBT, cognitive behavioral therapy.
Yeah, absolutely.
Because, you know, that has got some clinical evidence behind that it helps with hot flushes and night sweats. And there's a good self-help guide that you can buy a book on Amazon by Myra Hunter, which will help you to manage your own CBT. CBT is changing the way that you process your thoughts, because a lot of the time we get very negative and we start to panic and get anxious. And it's just a way of reprocessing and rewiring your thought process. And you can do it yourself a little bit, you know, you don't.
And also it is available on the NHS as well. If you do go to them and you ask for it, then if you wait a couple of weeks, their mental health part of them, they will call you and offer you it and stuff, which is a really good thing to do. The same way as I'm saying, if you haven't just, you know, get the Calm app, because you can do their talk, their meditation. It's £39 for the year, but you get a meditation every day. You get a great morning stretch. It's like, I think it's like 8 minutes. So it opens up all of your chest. And so it's just got little steps that you can wake up, do a stretch with them, then do a meditation. I wouldn't do a meditation the minute I wake up because you just fall asleep. I would go downstairs or do something, have a cup of hot lemon and water. But the clearing of the mind and the easing and watching the breathing is great. Yes. All this mindful stuff is, I think, the way that we're moving. So you have to remember that we're getting into this whole new era. With all the doctor stuff, we now know that, you know, walking, mindfulness, stillness, you know, because I got told the other day that we take more information daily than Shakespeare took in his whole entire life.
It does feel like that at the moment. Life does feel, you know, I mean,
you know, we have all this. It's because everything is so quick and accessible. Do you know what I mean? If I like that dress, you used to sort of save up, and then you used to, you know, wait and then maybe go on a Saturday and go to the shop. Now you just press boom. And with me, it's like, you know, these delivery, because they're in London, it's with you in 90 minutes, delivered to my door. It's just, everything is just too, you know, we're too many materialistic things.
That's what it is. So that's, I think we've done quite a lot on that, and I will recover some of these.
Well,
Facebook Live,
because we will keep, if we can keep doing these, guys, we will keep doing them, because if we keep them to like 30 minutes or 35 minutes, then, you know, we might be slipping between your clinic and something I'm doing. I think we should, but I think we've got a few more weeks to go, ladies. So you know, keep your questions coming. Dr. Harper and I will have a chat over the weekend about what we shall discuss. If you've got any ideas, DM me or Dr. Harper, because we're always interested. And anyway,
was because someone had said to me, I really wanted to know about vitamins and herbal supplements and alternatives. And Victoria, I just want to say, yes, it's Myra Hunter, and I will put all of this up on my website, and with regards to the alternatives and the herbal supplements.
Yeah.
But I'm just saying
And
that,
if also anybody is looking for a nutritionist or, you know, about herbs and supplements, there is Rosemary Ferguson, who is an amazing nutritionist, and, you know, you can get an appointment with her as well, or
well,
you
I
can
think
follow
I
her.
have to give a shout out to Emma Bardwell, because she's really great, and she does really
Yeah.
good sort of menopause and perimenopause
Yeah, just
nutrition as
put them
well.
out
So
there,
there
because
are a few
everyone's very
out there.
interesting.
Okay. Yeah, so
Let's reduce
you know,
hot
do let
flushes.
us know what you
Okay.
want us to discuss, because I think there's so much to discuss.
Yeah, we have. Yeah. What's this one saying? Could he
what is your website
talk
address?
about? What is your website address, Doctor? Do you want to give it to them?
Yeah, it's
W is it?
www.theharperclinic.com. So it's very easy,
Yeah.
theharperclinic.com.
Brilliant. Thank you, ladies. I shall put my patch on now. I would have had it on
Yeah.
first thing in the morning. Why are you putting it on now? Okay, guys. Thank you, Dr. Harper. Lovely to see you. Have a great weekend.
Lovely to
See you
see you
later.
guys.
Bye.